Okay, perfect. So hi, I'm Kerrie. I'm a dual registered midwife and paramedic that works here at EEAST, and I work alongside Damon.
Hi, I'm Damon Wedden from the East of England Ambulance Service.
So what we're going to go through today is physiological management of the breech. So whilst a lot of the previous breech management looks at the mum lying on her back, ideally actually they should be upright because that gives gravity as an aid to help the baby come down, and the growing body of evidence is showing it is the optimal position to have a breech birth. So ideally when we attend these scenes we should be encouraging the birthing person into an all fours or a kneeling position if they're not already in that. Which we have our mannequin in today to talk you through. The manoeuvres are similar, but they're going to look a little bit different. So they achieve the same goal, if you like, but we'll go through them and we'll talk through them as we do it and what we're looking for. So as the bottom is born, we're going to kind of want to note time of that, and that's usually probably hopefully about 5 minutes before the baby is born. So as the baby comes down, we encourage it. If we find that as the baby comes down, this baby has very helpfully put itself kind of laterally, if you like, in the transverse, so its legs are sitting, its pelvis is in line with mum's pelvis. You want to only be able to see one person's back at a time. So in this position we can see mummy's back. In the opposite position you'd be able to see the baby's back. So that tells us that the baby's in a really optimal position. If we found that the baby wasn't coming very quickly, or the baby was on a little bit of a slant like this, that can sometimes tell us that there isn't quite enough room for the baby to come down. Really easy, nice form of management for us as pre-hospital clinicians. The best thing to start doing is just to get the birthing person or the mum to wiggle their pelvis, absolutely like that. And then if we find that baby still isn't coming down terribly well, it's a move called the running start. But essentially, as this baby is, we know that their head, from the position of their back, is looking in this direction. So what we would do, and I probably will have to demonstrate it on myself, is ask the mum to bring this same leg up as the baby is facing, to help just create a little bit of extra space in the pelvis on that same side, which just helps the baby to rotate around. So after that, as the baby starts to come down, we should see that, as I said, that nice inline transverse progress of the baby, and we just get them to keep coming and keep coming. If we get to a point where the legs aren't coming, we can do exactly the same as we would do the other way around and just gently sweep them up and out and bring those legs down, and then we just take our hands back off the baby. We're always going to be encouraging that mum to push and keep it going, and then hopefully as we continue to progress with gravity we're going to see those arms deliver. That's it, beautiful. So she's doing really, really well. So we can help just sweep that a little bit across the chest there, and the same here because we've got a nice amount of space. And then as the baby's head comes down, hopefully the baby will deliver themselves. But if they don't, we can do a manoeuvre called the shoulder press. So it's always about seeing continuous progress. So with each contraction, you're going to anticipate that you're seeing slightly more of baby than you were seeing last time. If we're not seeing that progress, the initial move is to press, we want to kind of bring her across the surface, but we're going to press below the clavicles, and it's really important that it's below to get that right trajectory of pressure, and we're going to push backwards, and as we push backwards we can see that baby's head is starting to come there. If there isn't quite enough pressure in that mode, we can bring our thumbs just below the clavicles as well and push backwards there, and get that nice sweep of the baby's face over the perineum, and the baby delivers nicely. Beautifully like that. So really minimal intervention compared with our other breech manoeuvres. But it's just remembering that when we are applying that shoulder press, that we're pressing towards the mum as opposed to pulling down, because we're aiming to just create that flexion with the head that's going to encourage the head to sweep across the perineum and aid that birth of the baby. Now with breech babies, it isn't uncommon for them to be a little bit stunned at birth, so we're going to do exactly what we would always do, is we can pass the baby up and under, not up and under, but under and through rather, up to mum, and then she can bring herself onto her bottom, and we can pop baby in skin to skin to do really nice tactile stimulation with them, pop that dry hat on, and then move on to any newborn life support that might be required after that.